instructed the appointment of a task force to consider the feasibility of introducing unemployment insurance, a pension plan for farmers and fishers, and national health insurance. A national health insurance subcommittee was appointed in order to compile and present a report on the feasibility of introducing a national health insurance scheme in St. Lucia. The task force has completed its report. That was in the year, the task force was formed in 2002, and the task force reported on the 21st of July 2003. And this is the report of the task force. It's a National Health Insurance Task Force report, June 18, 2003. That is the report of the National Task Force. I just want to go to you briefly as to what the task force said on universal health care and where we could have been as far as universal health care is concerned. It's a very comprehensive report, right? Like it outlines the illnesses, etc., and it tells you how we would finance national health care. It says national health care would cost the country $58.5 million. A national health care service would cost the country $58.5 million. National health care means that the people in the country, everybody in St. Lucia, would get access to a set of basic health services. Basic health services free of charge. So the problems that we have now of going abroad to look for treatment for prostate cancer and etc. would have been eliminated because everyone would have made a contribution towards the health of the country. Now, it took the $58 million that it cost in 2003 would have been made up as follows. The consolidated fund, that is the government's coffers, would put $29.7 million. So the Treasury would contribute $30 million. And the country generally would contribute the remainder to get to the $58.5 million. How would the country contribute the remainder of that money? There are several ways by which the task force said that the country would support. Because you see, it's a matter, in national health, it's a matter of everybody contributing to benefit one body. That's the basis of national health. Where will the country get the money from? There are several ways that the task force said the country will get the money from. So we're not saying to you that you'll get a national health care service free of charge. What we're saying to you is each one of you would contribute something that would benefit every one of us. So here is the suggestions by which we could raise that money. Either an environmental levy of 4%, or salary deductions from everybody, 1%. So that means if your salary is $1,000 a month, you would be paid $10. 1.5% or 2%. That depends after you work the maths, so everybody would make that contribution. The third way would be an electricity levy. That means a charge on your electricity bills. So not the electricity bills with your service, not service, what do you call it? The fuel charge, your basic electricity bill, 5%. Or telecommunications levy, that's on your cell phones, etc., 5%. So the government would contribute $29 million, and the public would contribute the other $28 million to have a universal health care service. These plans were to a state of advancement, and they started by giving diabetes and hypertension treatment free of charge. It would come in a basket of medical services. So we start with diabetes and hypertension, and you move to probably, I don't know, I'm not a doctor, but you move to a basket of services. And over a period of time, the entire country would have available to it universal health care. So that is something that's feasible, and that is something that can happen.